During the Industrial Revolution, the growth of towns to house the ever-growing number of workers created big new problems of public health. The next clip describes social conditions in British cities in the 1830s. As you watch it, make notes about the public health problems which became part of city life.
The first industrial revolution was well underway, with mills and factories powered by steam producing more and more heavy goods and textiles. As well as this, the population had nearly doubled in 30 years. There were not enough homes for the people who crowded into the towns to work in the mills and factories. They were often forced to live in cellars and attics. Worst of all, there was no effective drainage or sewage disposal. Many people had to get their water from pumps that were often a long way from home and only turned on for a few hours a week, while the muck that lay around in the unpaved streets was seldom carted away. It's no wonder that diseases like typhus, tuberculosis, and now cholera were so devastating.
You should have made a note of the following. The population doubled in 30 years. The housing shortage led to massive overcrowding. And poor drainage and sewage and lack of clean water meant diseases such as typhus and cholera became rife. To begin with, government didn't think it was up to them to deal with these problems. But during the 1830s and 40s, there were particularly bad outbreaks of cholera and typhus. Parliament began to recognise it had some responsibility for public health. In 1848, the first Public Health Act was passed. It gave local councils powers to provide clean water and sanitation, if they wished. By 1875, attitudes had changed in favour of government action, and Parliament passed new laws compelling councils to act on clean water, sanitation and slum clearance. Yet even at the turn of the 20th century, there were still very high levels of infant mortality. There was also a new Liberal government, ready to intervene much more directly in the health of the nation. As you watch the next clip, make a plan for an essay in answer to the following question. It's one you could well come up against in the exam. Improving the health of the nation was a bigger problem than just public health. Is this true, and how did the Liberal reforms of 1906 to 1911 begin to tackle the problem? You should plan to write 1.5 to 2 sides on this question, which would be worth about 12 marks.
Are still living in slum conditions.
The effect of poverty on health was still very obvious.
Some 8,000 slum dwellers.
Council records show an increase in death rates amongst very young children.
The home of Drake, of whom she is justly proud.
In 1840, 144 out of every 1,000 babies had died. By 1899, it had gone up to 163 babies in 1,000 who died before the age of 1. By now, working people were beginning to get organised into groups which demanded changes. The British Empire also needed many more able-bodied people. The government wanted to send fit, healthy men to administer the empire. And the armed forces wanted to see health measures brought in, because during the Boer War, fought from 1899 to 1902, many recruits had not been fit for service. The massive concern from all sections of society meant that the 1906 Liberal government passed new laws. The kinds of laws that had never been passed before, to give poor people help. 1906, school meals were provided for needy children. 1907, schools had to give medicals to children. All births had to be notified to the health visitor. 1908, old age pensions were paid. 1909, the building of back-to-back housing was banned across Britain.
When the housebreakers take charge, you can really see how rotten these places are.
At the beginning of the 19th century, there was little government interference in health matters. By the beginning of the 20th, there was a lot. People began to accept that poverty might be the cause of disease. They also began to accept that poor people could not be blamed for poverty.
Your essay plan should look something like this. Paragraph 1 explains that poverty was the real problem. Poor health was the result of poor housing, poor diet and poor health care, especially for the most vulnerable, the very young and the very old. Paragraph 2 shows how the liberal reforms began to address these problems. Children needed better nutrition and have their health problems spotted before they became too serious. Free school meals were introduced in 1906 and medical inspections in 1907. Paragraph 3 could cover the banning of back-to-back housing in 1909, helping to improve conditions for millions of working-class families. Paragraph 4 could deal with the introduction of old-age pensions, also in 1909, to give people some means of support when they were too old to work. Paragraph 5 could cover the introduction of national insurance in 1911 to help families who would otherwise go hungry because of sickness or unemployment. Finally, in your closing paragraph, you could point out that these reforms were a good beginning but didn't solve the problem. Poverty was still rife. More was needed, particularly to help with the cost of medical care to poor people. So, after the Second World War, the new Labour government put forward a plan for a free national health service as part of an attack on the 5 problems of want, ignorance, disease, squalor and idleness.
It was paid for out of taxes and national insurance contributions, so that everyone could have health care regardless of how much they earned.
I've been asked to tell you just a little about this new plan for better health. Our plan is a service which will provide the best medical advice and treatment for everyone, every man, woman and child in this country.
For the first time, high-tech surgery and expensive drugs were freely available to poor patients. They didn't have to rely on charity, as many had in the old hospitals.
The evil of disease must be overthrown. The voluntary hospital and the expensive nursing home are not enough to maintain this nation in good health. The finest surgery must be for all. Disease is too deep-rooted for the hurried diagnosis of the ordinary doctor with his few stock medicines. State funds must subsidize research on an adequate scale.
The completely free service didn't last. By 1952, just 4 years later, prescription charges were introduced, as the costs of maintaining the service became larger than the government was willing to pay.
To a shilling per item, but the doctor gets no more. Costs are rising for all of us, for the healthy, for the sick, for the chemist, for the doctor.
But the National Health Service still continued to have the belief that ordinary people should have access to the very latest techniques.
That's the end of the section on public health in Britain. Now for the last of our themes.